Today we're fixing an ingrown toenail. So what an ingrown toenail is, and you can see I've already numbed up this toe a little bit for our procedure, but an ingrown toenail is the corners of the nail, usually on the great toes, curve into the sides of the skin. Now that can happen because patients aren't cutting their nails straight across. It can happen because their shoes are tight. But in this case, she's got the lucky benefit of having the genetics that make that nail curve, okay? And what happens is it starts to dig into the corners. So what we'll be doing today is, I've already numbed it, you can see, but I'll be taking thin slivers of the nail on either side because she gets pain on both sides, and applying a chemical called phenol that prevents that from growing back. Now I'm taking a small enough piece so that she doesn't have a goofy looking nail, but a large enough so that her pain goes away. So now that it's already numb, the next step is we're just going to scrub it a little bit here. This is betadine. This just cleans it. Now toes are generally dirty no matter what you do, unfortunately, but we're going to try to optimize the situation where we're not going to have a lower risk of getting an infection after this, which is actually quite rare. Once you decompress that corner of the nail, then there's a little space there. Any bacteria that gets in can easily get out and be killed by any antibiotic ointment that we apply there. So before we start, we want to add this little thing. It's called a tourniquet, kind of like a tourniquet. And what it does is it stops her from bleeding during the procedure, because any blood that were to flow during the procedure could potentially irrigate away the medication I'm going to apply. So we're going to take a thin sliver out on both sides. Do you feel any pain when I touch you like that? Or just pressure? Pressure or pain?
Pressure.
Pressure, okay. So we're just releasing that from underneath. If you zoom in close, you can see me kind of working my way underneath that nail. Any pain there?
No.
Good. So once we've done that, we're going to take this other instrument. This is one that you're not going to have in your cabinet at home. It's called an English anvil. I'm just splitting that part of the nail that's digging into her skin, making sure that the piece I take out is big enough to resolve her issue, but not too big to make her toenail look silly, and then she tells people at the beach that I did it and I look bad. I don't want that. So we're going to finish that with this little tiny blade. This goes underneath the skin to finish that last cut, because that nail grows all the way underneath the skin. And once that's released, we'll grab what's called a hemostat. This is usually for grabbing vessels or used in surgery for other reasons, but it's a great little tool that can grab that nail. And once we clamp that, we're going to kind of twist towards the nail itself. We're just going to twist it towards the midline, and that should flip that little nail out of there. You can see the nail matrix, which is the part that grows the nail in the back there. There you go. So just that little piece in the back. It's kind of more white in appearance than it is on the outside, and a little bit of abnormal, skin will remove that as well. And we'll get the other side. The next step will be we're going to apply the medication called phenol. And we'll typically do 3 applications to each side, and that kills the cells that grow the nail, called the matrix cells. But it doesn't kill the cells on the outside, because those cells on the outside that are related to our skin are very good at resisting trauma and damage, because they're our barrier to the environment. Cotton swabs, we're going to work those into the corner here. And that's a great look, right? Like I would say it's like My Favorite Martian or Mork and Mindy. I don't know what the modern reference would be.
I think there is one.
I don't think there is.
I would say Ren and Stimpy. That's the
Ren and Stimpy, great. Yeah, there you go.
That might be the latest.
Space Madness episode, right?
Yeah.
I used to love that show. So we're doing about 30 seconds each application. This is our last application. So this is our third of 3 30-second applications. Some people do 4, but I haven't found that's necessary. It just causes undue trauma. So the next step is we want to get rid of some of that chemical in there, because it can continue to cause a little burn. So I'm just rinsing that out. Once that's rinsed out, I'm just going to pat that area dry a little bit so she doesn't have that moisture on her foot. And at home, she has a little kit that she's going to take home with her that has a wound irrigation, like a spray in there that will clean the area, which you can rinse out after you put it on there, and that's just going to kill any bacteria that are in there. It also, every time you take a shower, it helps to work out some of the residual chemical that's in there. But you can see she's not bleeding, the nail looks normal, the skin will heal over time and just kind of move back in there, and then she'll go back to cutting that nail straight across. But the chemical we use is actually a cautery agent as well. On here I have a little medicine called Silvadine. It's actually designed for burns, so it works great for this. And at home, she has a little dropper of ointment called hydrogel she's going to apply, and then a piece of gauze and a wrap of Coban. And every day the dressing will get slightly smaller based on how much drainage we see on that gauze. So hopefully just in 5 days or so, we're already going to wearing a Band-Aid. But we absolutely want to keep it covered because we are told the wives' tale that let the air hit it. That does not help with healing. You know, it's very synonymous with you're growing a garden. You don't throw your seeds on dry soil and walk away. You have to put some water there to help them to grow. Your cells are the same way. So you wrap just like that. Should be able to fit in a shoe just fine. She'll see me back in about 2 weeks, at which time we'll probably be able to stop putting dressings on, and she'll be able to go jump in a lake or hot tub at that point and not have to avoid the gross areas. And that's the matrixectomy procedure for ingrown toenails.